The healthcare system works, it's just that it doesn't necessarily work for you. For many people, healthcare feels expensive, confusing, and sometimes ineffective. Not because care doesn't exist, but because the system isn't always designed to solve the health problems people are actually facing today. Modern healthcare systems were built to handle acute problems: infectious diseases, sudden injuries, and emergencies, things that require immediate intervention. And in those situations, the system often performs extremely well. If something goes wrong suddenly, there are systems in place to diagnose and treat it quickly, but that's only one type of health problem. Today, many of the most common health issues are chronic. Things like heart disease, diabetes, and long-term stress-related conditions don't have quick fixes. They require ongoing care, complete lifestyle changes, and preventative treatment. But most people still interact with the system only when something gets worse, not when it could have been addressed earlier. And the reason people aren't interacting with the system earlier mostly boils down to cost. As we all know, healthcare has become insanely expensive. For many people, even basic care can be financially out of reach. And part of the reason is how the system is funded. Many providers operate under a fee-for-service model, meaning they get paid for each test, procedure, or treatment performed, not for preventing illnesses. This structure can unintentionally prioritize short-term interventions over long-term solutions. This allows the healthcare industry to make a lot more money, as they are essentially able to charge patients by treating the same condition over and over again instead of providing a long-term solution. Combined with insurance complexity, administrative overhead, and high medication costs, patients often face bills that feel overwhelming, even when they are following the system correctly. Even with access to care, many patients leave appointments without their issues fully addressed. This often occurs due to various reasons, such as doctors having limited time with each patient, insurance rules that can restrict treatment options, and because chronic conditions often require lifestyle or systemic changes instead of just quick fixes. The system works best for isolated interventions, but struggles with long-term solutions that actually improve overall health outcomes. The reality is that the system wasn't designed to prioritize affordability or long-term wellness. While emergency care and acute treatments are strong, the system often leaves patients paying high costs for care that doesn't fully solve their problems. Preventative care, health education, and holistic management are all currently undervalued, which means people continue to cycle through appointments and procedures without ever seeing lasting results. So while the healthcare system does work, it just doesn't seem to work in the way most people need. Understanding its design, incentives, and limitations will be the key to navigating our health more effectively. And thinking and talking about the issues within the healthcare system could allow us to eventually make the changes necessary to actually meet the needs of patients today. And just like with healthcare, zooming out and analyzing systems and their structure can often be the key to solving problems not only in our society, but also our individual lives. If you want to go deeper into systems like this, I put together a free beginner's guide to modern systems. It breaks down what a system is, as well as a few prominent modern systems in a simple way, and is a great place to start if you're wanting to start better understanding systems. You can download it using the link in the description that will also add you to my email list, where I'll be sharing new system breakdowns, updates, and resources as they come out. This guide is completely free and was designed with the intention of helping you learn these concepts so you can start applying them to your own work. This guide is completely free and was designed with the intention of helping you learn these concepts so you can start applying them to your own work.